Hello again and welcome to this part of your Caesarean section recovery. Okay, so this is going to be sort of for 5 to 8 weeks or 5 to 7 weeks or 5 to 6 weeks, getting that nice little bit of fine tuning before you go for your 6-week checkup and before you hopefully get the go ahead to start bringing yourself back to exercise. So hopefully you're feeling good. Okay, if you're not, start thinking about your 6-week checkup and the questions you might ask. So if you have any pelvic girdle dysfunction or pain that's still there from the pregnancy or new onset low back pain since you had your section, if you're having trouble with your pelvic floor, if you're feeling any pressure or if you have any symptoms of leakage or signs that your pelvic floor might be a little bit weak, if you have coccyx pain, anything like that, please mention it to your GP and think about going to a specialised physiotherapist. So somebody who has experience in women's health, who might do an internal exam, check your pelvic floor muscles, who can have a look at your posture, look at the muscles around your pelvis, see if there's anything going on that they might be able to help with. Make sure you're doing your pelvic floor exercises, and really this kind of gentle movement gives you an opportunity to see what's going well and what's not going well and allow you to apply all that to your postnatal recovery. So any of you who are looking to get back to higher intensity exercise, you need to pay attention to your pelvic floor, pay attention to the strength for your single leg exercises. I have lots of videos on getting back to running, some postnatal videos, and I have my program. So there's the postnatal program that'll just bring you from that 6 to 8 weeks onwards. It's an 8-week program. I have a MyFit Prolapse program, MyFit Diastasis program. If you're starting to identify more specialised needs that you need for your exercise programs, or you might have your own plan, but just be careful when you get back to higher intensity exercise. So, for example, lifting weights, running, anything that involves, increasing the load through your tummy, that you take your time. So it doesn't really matter what you have. So if you had a prolapse or a diastasis, it's all about taking your time, finding the exercise that suits your needs and checking in with your professional if you need to. Okay, let's get down onto the mat. So hopefully you're moving a little bit easier. In and out of bed is getting easier. Going for your walks is a little bit easier. We're going to challenge you a little bit more, but bearing in mind that we're still in that recovery phase, where rest is just important. As activity, we're going to roll back and roll forwards, roll back, lifting your tailbone and roll forward. So this should be a nice flowy movement that you're getting that arch in your back and that you can arch forwards and you can get that little bit of a stretch through your lower tummy muscles without causing any pain or stiffness. Roll back and roll forwards, and one more roll all the way back and forwards. Come into your halfway position. Okay, bring your knees and your heels together, bring your arms out wide, just rolling to the side. So we're just warming up through the pelvis, through the tummy, through your lower back. Roll to the side and then over to the other side. Lovely, rolling over, so taking your time, and over to the other side, coming back to the center. Bring your hands onto your tummy, roll back and roll forwards. Come into your halfway position. Breathe in, feel your tummy rise. We're going to warm up those core muscles with our pelvic floor set. Breathe in and breathe out, pulling up through your back passage and your front passage, and hold for 10, 9, 8, 7. Get that little breath in. 5, 4, 3, 2, and 1. And release for that whole 10 seconds. Lovely. Relax out through your shoulders. Glide your shoulders up towards your ears and glide them down. Get a little nice bit of movement through your shoulder blades all the way up and down. Breathe in and breathe out. Pull up through back passage and your front passage for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And release the whole lot out. So pelvic floor alone, if you're having any symptoms, we can add a little bit to it to challenge the pelvic floor with a bit of movement, which is the way we should be doing it anyway. Let's go take a breath in, and on the breath out, start your pelvic floor squeeze. So pull up through your back passage and your front passage. As you're holding that squeeze, we're going to slide away the leg and we're going to slide it back in for the last few seconds of the pelvic floor and release the whole lot out for that nice relaxed phase. So really important that the pelvic floor releases all the way, so then it has the capacity to do a big maximum squeeze. Okay, so breathe in. Tummy is rising, breathe out, activate your core. Pull up, 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 through your back passage, through your front passage, slide away one leg, and coming back in for that last 5, 4, 3, 2, 1, release your pelvic floor. So feeling that softening through your tummy, okay? So your tummy muscles can get tight and overworked rather than what you'd expect, which would be kind of weak, soft tummy muscles. So making sure you have the release in all elements of your core. Breathe in And breathe out, activate your core. Switch up, up, up through your pelvic floor. Slide away the leg. 3, 4, 5, 6, 7, 8, 9, 10. And release out through your pelvic floor. Release out through your tummy. Lovely. Breathe in again. And breathe out, squeezing up through back passage and front passage. Nice, strong, fast, hard squeeze. Slide away the leg. Point the toe. Tuck in through your heel. Come back through the center and release. And then make sure as you're sliding away your leg that your back isn't pulling off the mat, that you're not seeing the ribs lift, that your tummy isn't starting to bulge. If it does, obviously just start bringing like a little half a slide in. And I said obviously, but nothing obvious about it. Obviously you need to bring it back down a small bit because it's a sign of overload. Breathe in to prepare and breathe out. Activate through your core. A nice strong hard squeeze. Slide away your leg. And a nice stretch to the hip flexors through the quads. Slide in your leg. Keep the pelvic floor switched on. 3, 2, 1, and release. Well done. Reach your arms up towards the ceiling. Continue with our pelvic floor exercises, bringing in our real life action moves. Breathe in. On the breath out, pull up through your back passage and your front passage. Hold it there for 2, 3. Reach your arms back. 4, 5, 6, 7, 8, 9, 10, and release. Really nice. So just bring your attention to the ribs as you switch on your pelvic floor, as you drop your arms back, that your ribs don't lift up off the off your body and away from your spine, pointing up towards the ceiling, that they stay kind of gently drawn in. So breathe in, breathe out, pull up strong and hard through your back passage. Feel your ribs drawn in. Drop your arms back overhead with the pelvic floor squeeze. That's it. And draw them back to the center. Hands on your tummy and release out through your pelvic floor. Excellent, that's your pelvic floor work with a little bit of core done. We're going to do some fast pelvic floor squeezes. So nice and relaxed. We're going to do our 2 seconds on, 3 seconds off, okay? So let's go. Squeeze up, 1, 2, release, 1, 2, 3. 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 Lovely. Draw one knee up to your chest. Just see how that feels. So some of you find that really, really easy. Others might find that's a little bit tight through the center, particularly if you had pelvic girdle pain or anything like that during your pregnancy. Bring your hand onto your tummy, pelvic tilt back and forwards, come into your halfway position, breathe in, and on the breath out, activate your core. As you activate your core, you're just going to drop one knee out to the side. So we're just going to release out through those inner thigh muscles. Hold there for breath in. On the breath out, reinforcing through your pelvic floor, draw the knee in, breathe in and breathe out. Make sure the other knee doesn't go following it or it doesn't start drifting out. Get a nice little stretch through your inner thigh muscles, through those adductor or groin muscles. Come back to the center. Breathe in and breathe out. Drop your knee away. Hold there for breath in. And on the breath out, come back to the center. Breathe in and breathe out, dropping your knee to the side. Breathe in, come back to the center, breathe out, dropping it down. So as you start off, hold there for the breath in, and as you breathe out, come back to the center. And if you're going towards maybe 4 or 5 weeks, or you're feeling really good, just keep the movement going. Get that nice stretch on the breath in, and on the breath out, come back to the center. So breathe in, drop out the knee, and come back to the center. So you can just speed it up a little bit with the core switched on. Make sure your pelvis isn't lifting on either side. So breathe in to prepare, breathe out, drop out your knee. Breathe in, hold it, breathe out, come back to the center. No wobble at the pelvis. Breathe in to prepare, breathe out, drop back, breathe in and breathe out. Breathe in again. Breathe out, activate your core, drop your knee out to the side. Breathe in, come back to the center if you want to speed it up a little bit. Breathe out, drop out the other knee. And breathe in, come back to the center. So pelvic tilt, roll back, roll forwards, come into your halfway position. Reach your arms up towards the ceiling. I'm going to bring a little bit of upper body, lower body together. And remember those ribs. So you're just tending to just drop them in towards your spine. Breathe in. And on the breath out, activate your core. Don't let your back arch. Breathe away. Breathe and slide out one leg, drop your arms back overhead. Breathe in, come back to the center. If you find too much sliding out the leg, just do your arms. And if you can bring out the leg, go for it. breathe in, come back to the center. Breathe out. If you have doming, which is doing this, what I would consider a simple exercise, it means your body's overloaded. Spend more time recovering, just do your arms, or if you want to just do your legs, go for it. Really good. Hand on your tummy, roll back and roll forwards. Come into your halfway position, breathe in, and on the breath out, activate your core, scoop up one leg into tabletop. Hold it there for breath in, and on the breath out, drop down. Breathe in and breathe out. Lift up your leg. Hold it there for breath in. On the breath out, drop down. Breathe in. Breathe out. Pulling up through your pelvic floor. Breathing up the leg. Hold it there for breath in. On the breath out, drop down. Breathe in and breathe out. Activate your core. Bring up one leg. Hold it there for breath in. And on the breath out, drop down. Breathe in again. And breathe out. Lift up. Hold it there for breath in. On the breath out, drop down, breathe in, and on the breath out, lift up one leg, hold it there for breath in, and on the breath out, drop down. Well done. Turn over onto your side, so nice and steadily over onto your side. So ankles, hips, shoulders are in line. We're going to wake up another set of muscles in our rotations. So last video we worked on rotations of the upper body, and we'll do that again, but we're just going to work on rotation through the hip, okay? So just resting your hand onto your head on a pillow, so keep your neck nice and supported. Other hand onto your pelvis. We're just going to float the knee up towards ceiling and lower it down. So just switching on those glute med and glute min, piriformis and rotator muscles. So if you're finding it difficult to get that knee above the height of the hip, it's a good muscle to start working on. So what we're doing is we're just shortening the muscle between your hip and your sacrum there. So really important muscle for stabilizing your pelvis and also for offloading your knees. So sometimes people get a little bit of irritation to their knees when they start going back to exercise after having a baby. And sometimes it can be as simple as just strengthening up those glutes. So lifting and lowering. And let's go for 3, 2, and 1. Give your muscles a nice little thump. And we're going to do another short little set. Hand onto your pelvis. And let's just go for 5, nice and slowly. 4. So we're working the legs. So we're offloading through your scar. So a nice muscle to work on. 4 and 5. Give your muscles a nice little thump. Reach your arms forwards and front. Breathe in. And on the breath out, lift up and open back. That's it. Holding there for breath in and out. Breathe in again and out. Breathe in again and breathe out. Coming back to the center. Breathe in again and breathe out. Lift up, reaching all the way back. Hold there for breath in and out. And breathe in and out. Come back to the center. One more. Breathe in and breathe out. Reach all the way back. Perfect. And come back to the center. Lovely. We're going to come up and we're just going to switch to the other side. Perfect. Bring your pillow with you. And we're going to start head nice supported, knees bent, ankles, hips, shoulders in line, hand onto your pelvis. And we're just going to do a little bit on that hip as well. So just lifting and lowering. Really good. And go for 6, 5, 4, 3, 2, and 1. Give your muscles a nice little thump. And off we go again for a set of 5, 4, 3, 2, and 1. Give your muscles a nice little thump. Reach your arms together in front. Breathe in. And on the breath out, lift up and just open out through your chest. Breathe in and out. And breathe in and out again. And one more. Breathe in. And breathe out. Come back to the center. Breathe in again. And breathe out, reaching up and out. Open out through your chest. Breathe in and out. And again. And again. Come back to the center. One more. Breathe in. And breathe out. Lifting up and out. Out. Open out through your chest. Breathe in and out. And breathe in and out. Come back to the center. Perfect. Now, if you're comfortable lying onto your tummy, we're going to come over onto your tummy. And if you're not, just fast forward a little bit to the end and you can do this in your own time, okay? So just resting your face, your forehead onto your hands. Hopefully you're feeling comfortable lying in your tummy. So we talked a little bit about the stretch through your hips. So just getting used to getting that extension through your hips, a little bit of a extension as opposed to your tummy, a little bit of stretch through the tummy, just resting your forehead on your hands. Glide your shoulders up towards your ears and slowly lower down. Glide up towards your ears and slowly lower down. So really important exercise for preventing stiffness to your neck and shoulders when you're feeding. So glide up towards your ears and lower down. And one more, glide up to your ears and lower your shoulder blades down towards your waist. And we're going to try a little pelvic tilt in this position. So you're just flattening your back, tucking in your belly button and arching. So exactly the same thing as we did lying on our back, only we're lying on our tummy. So there's a little less movement because the knees aren't bent. So flat back, arch, come into your halfway position, and we're going to breathe in, and on the breath out just activate through your core. So pulling up through your back passage, front passage, hold for 5, 4, 3, 2, 1 and release. Okay, breathe in, and on the breath out you can continue just getting that 5-second activation, or if you can just squeeze the glutes and lift up one leg and hold it for 3, 2, 1, lower down, lift up the other leg. So we're just going to switch on the core as we lift 2, 3 and lower down. So this exercise is really just to get that extension back and get those glutes to fire up. So we don't want to forget these muscles, and we don't want to see you starting to walk with a little bit of a bend forwards as you protect the tummy muscles after cesarean. So this is just kind of waking up your good postural movements again, and also remembering that we're still recovering, still resting, so we're just activating those muscles. That's it. And go for 4, 3, keeping your pelvic floor switched on, 2 and 1. Perfect. Bring your hands under your shoulders, push up to your hands and just come up onto all fours. So a big difference between sort of your 5 weeks and your 8 weeks when it comes to this position. So once you're comfortable in all fours, all we're doing is our pelvic tilting, rounding up your back and arching down. So you round up, it'll be shortening your tummy muscles, probably what you're used to, and then just to arch down, getting that little bit of gravity, bringing you into extension. So again, keeping it nice and comfortable. Round up and arch down, and one more, round up and arch down. Sit back onto your heels and stretching through your spine. So getting more confidence in your movements, bringing yourself out of positions of comfort. Breathe in and out and breathe in and out, and also moving. So really good to stretch out these lifting muscles. Walk your hands over to the right side, left hand overlapping right. Breathe in and out, breathe in and out, and walk your hands over to the left side, right hand overlapping left. Breathe in and out, breathe in and out, and just coming up into your sitting position. Drop one arm down, side bend, up and over, and switch to the other side. Reach both arms in front, breathe in, and on the breath out, lift up nice and tall. Bring the arms apart, just do some rib raises, pushing through the ribs. Perfect. And just give your shoulders a nice little roll, shrug up and down and up. Keep them nice and low. Bring your ear to one side and then bring your ear to the other side. Perfect. Look over your shoulder. Bring your nose down in the direction of that shoulder. And then look over the other shoulder and nose down in the direction of that shoulder. Brilliant. That is it for this video. I hope you're finding it good. There will be a big difference the first time you do this video to when you're doing it a couple of weeks later. So again, just to recap, this is the opportunity now to get back to your normal exercise. Think about what you want to do, talk to the right people, make sure you're feeling good, and I hope you had a really good recovery. Be in touch if you have any questions or any feedback. Thank you very much. Well done.